Welcome to Integrity Linguistics Institute. Okay, so let me play the audio. Right, so we have Dr. Ravi here as well. Good evening. All right, so let me take the audio. So let's hear the audio script.
About knees. A lot of people say there are very high knee joint replacement rates in Australia, for example, because people do a lot of running in an attempt to keep fit. But this is another myth. In fact, studies show that for the majority of people, running's helpful in terms of stopping the onset of osteoarthritis. Though if you're a marathon runner, you do potentially place yourself at some risk. Now, if you've already got osteoarthritis and you want to take up running, the data's a bit conflicting. There are studies suggesting it can lead to exacerbations of the condition, but others suggest that patients who keep up their running do better at managing the condition than those who give it up.
All right. So let's understand that in simple terms. Okay, this is going to be a slightly tough question. It's an opinion type question. So here, more than giving importance to what the English is saying, try to understand the perspective of the speaker. Okay, so I'm going to play the audio once more. Let's hear the audio script.
About knees. A lot of people say there are very high knee joint replacement rates in Australia, for example, because people do a lot of running in an attempt to keep fit. But this is another myth. In fact, studies show that for the majority of people, running's helpful in terms of stopping the onset of osteoarthritis. Though if you're a marathon runner, you do potentially place yourself at some risk. Now, if you've already got osteoarthritis and you want to take up running, the data's a bit conflicting. There are studies suggesting it can lead to exacerbations of the condition, but others suggest that patients who keep up their running do better at managing the condition than those who give it up.
All right. So, okay. So here, we have to bring in the elimination strategy a little bit. And here they're talking about all the three answer options. That is A, B, and C. And your eyesight should go from B option first, then to C option, and then to A option. Okay. So here, let's take a look into the question that we have at hand. Okay. So here the question is, what does Michael say about osteoarthritis of the knee? So what's the topic over here? The topic over here is osteoarthritis of the knee. Okay, so not of the hands, not of the legs, only of the knee. Now the question is asking you, so what is your duty over here? Your duty over here is to find out what Michael is saying, okay, about osteoarthritis of the knee. That is the only thing. So we have answer options A, B, and C. And so here about, okay, so regarding osteoarthritis, what is Michael's information? Okay, so Michael is saying one information about osteoarthritis, and he's a rheumatologist. So he is going to be giving some information from that is coming from has his own opinion. Right. So this is an opinion-based question. That is, you have to think, okay, according to Michael, what is he thinking about osteoarthritis of the knee? So let's take a look into answer option A, B, and C. So what are all A, B, and C's over here? Answer option A, answer option B, and answer option C are basically the opinions that Michael has about osteoarthritis. Okay, so what is he saying about osteoarthritis according to Michael? Okay, so here it is Michael's perspective that is important. Right, so let's take a look into the keywords of answer option A. People with the condition are unlikely to benefit from running. So here, the condition. Okay, so what is the condition over here? Okay, so here the word condition is basically referring to osteoarthritis of the knee. Okay, so here people with knee osteoarthritis are unlikely to benefit from running. Unlikely means what? Okay, that is chances are very, very less. Okay, I am unlikely to win the lottery. Okay, that means the chances are very, very less. Okay, so people who already have osteoarthritis. Okay, so here they're talking about people who is suffering from knee osteoarthritis. Okay, and these patients, okay, they are not going to get much benefit from running. The chances of them getting benefit from running is very, very less. So here, what type of people you're dealing with? People who already have the condition. Okay, people who are already suffering from osteoarthritis. Now let's come to answer option B. Here, let's see what he is saying. Here he is saying running is probably effective. Okay, so he is saying probably. Okay, so he is saying, okay, there is a high chance, that is in his opinion. In his opinion, he believes, okay, that running is probably effective as a means of preventing it. Now, preventing it basically means what? Preventing means people who don't have osteoarthritis. Okay, so here this classification you need to understand. So in answer option A, people have osteoarthritis. Okay, they already have osteoarthritis. But when it comes to answer option B, here they are people without osteoarthritis right now, or you can say currently. So currently they don't have osteoarthritis. So that is why preventing it. Prevention basically means what? Prevention means to, prevent the onset. Okay, that is we completely want to avoid that particular disease. Okay, so that means he is talking about people who don't have osteoarthritis of the knee and is saying if you want to live a life where you don't ever want to get osteoarthritis, you should probably run every day. So he's saying running is probably effective as a means of preventing it. So he's talking about healthy people over here. Okay, so in answer option A, he's talking about sick people. In answer option B, he's talking about healthy people. Okay, so that distinction you should be able to make. So he's talking about sick people here. Here he's talking about healthy people. So if healthy people want to prevent osteoarthritis, they should take up running. And he's saying it is probably effective. Now let's take a look into C option over here. Marathon runners. Marathon basically means what? Running for very long durations. That is, 5 kilometer, 10 kilometer, 20 kilometer. Okay, so that is what we call as marathon runners. So marathon runners basically means what? Professional runners. Okay, so just because a person is running marathon once every 10 years, he does not become a marathon runner. Okay, marathon runners basically means people who regularly run marathons, right? That is very long distances. Marathon runners should take precautions to avoid it. Okay, now it over here, what does it over here refer to? It is also referring to osteoarthritis. That is, it is referring here also. See, this connection you should be able to make. Okay, so here the condition means osteoarthritis. It means knee osteoarthritis. It also means osteoarthritis. Now you see over here, what is the word over here? Should. Should basically means what? Compulsorily. Okay, you should be on time. You should eat your vegetables. You should wake up early, which means what? That is a rule. That is a compulsion. So here he is saying, so in his perspective, is saying if a person is a marathon runner, if a person is running regularly marathons, they compulsorily should take certain precautions. That is, they have to be very cautious. They have to be very careful to avoid knee osteoarthritis in the future. So here also he is talking about healthy people. Okay, he's talking about healthy people. Healthy people, those are marathon runners, they should take special precautions. They should compulsorily, they should take it to prevent osteoarthritis of the future. Okay, so this is what we understand. Okay, so now we have comprehended the question. So this is what we call as comprehension. Okay, comprehension is basically where you do the keyword analysis. That is, you identify the keywords and you underline them, you link them, and you understand. That is, you thoroughly understand what the question is asking you. And once you have understood the question, then it is retention. Okay, then you have to register this information to your memory. You must not forget what you have understood, and then only comes detection. So you must have a very solid focus. Okay, my duty over here, remember the word duty. Okay, my duty over here is to find out the opinion of Michael regarding knee osteoarthritis. Okay, so is he saying that people with conditions, people with the disease, they are unlikely to benefit from running? Okay, or running is effective to prevent it, or marathon runners should take precautions to avoid it. Right. So let's do the verb analysis. Okay, so verb analysis is going to help you to make the elimination a little bit more easier. So let's identify what are the verbs in the answer options A, B, and C. Okay, so here your duty is to find what Michael is saying about osteoarthritis. People with the condition are unlikely to benefit. Okay, now this is the action over here, right? Unlikely to benefit. That is, the chances of they getting any benefit is very, very less. Okay, so this is opinion number one. What is opinion number two? Running is probably effective. Okay, so here this is the action over here. This is the verb over here. That is, running is probably, okay, that is, it has a 60-70% chance, okay, of preventing it for healthy people to prevent it. And then let's take a look into answer option C. What is the action over here? Marathon runners should take precautions. Oh, okay, that is, yeah, marathon runners should take precautions to avoid it. So this is what he is saying in answer option C. Now you see over here, from very big sentences, now we have very small, tiny sentences. Okay, that is tiny phrases, and these are a little bit easier for you to keep it in your memory. Right. So unlikely to benefit. Okay, chances are very less, probably effective, and should take precautions. Okay, so again, this is a skill that you should be developing in due time. Gradually only it will happen. It will not happen instantaneously. All right. So now the retention. So comprehension is done. Now you must have a memory of the question. Okay. That is what we call as retention. And why is this important? Because when you're listening to the audio, you must not read the question because the audio will have a lot of distractors. So when you're listening to the audio, you should only look into the answer options. Only the answer options you must be looking. You must not be looking into the question at hand, because if you read the question when the audio is playing, you are going to lose your focus. Okay. But you should be looking into the answer options. And here, if you if you listen to the audio, you will see first they will talk about answer option B. Okay. So this is the first answer option they will, talk about. And then they will talk about, I think it is either C or A, but yeah, I forgot. Okay, so I think it is C second, and then I think it is A. Okay, that is, you will definitely be able to make the connection. Okay, first they will talk about running, then they will talk about marathons, and then they will talk about people with the condition and your eyesight. So accordingly, your eyesight should go from B to C to A, and then you have to determine what the answer is. Okay, so for that you should have a thorough memory of the question. Okay, so let's take a look into the audio script over here. Yeah, so this one. Okay, so we have listened to the audio script 2 times. So let's take a look into the written script over here. So he is saying, what about the knees? Okay, so again, he's talking about osteoarthritis. So the first sentence itself, the keyword is coming, knee osteoarthritis. A lot of people say there are very high knee joint replacement rates in Australia. Okay, so he's saying there are a lot of people, and what are they saying? Very high knee joint replacement rates in Australia. For example, because people do a lot of running in an attempt to keep fit. Okay, so what is the first sentence saying over here? Now you see the word but is coming. Now the word but over here is a contrast. Okay, so remember I told you the word but is a contrast phrase, which means this information. Okay, so this entire information over here is one information, and the word but over here is signaling a change. Okay, now he is saying the contrasting information, the opposite information. So let me explain it to you. Now, see over here, what is the sentence saying over here? In Australia, there are so many people. A lot of people say there are very high knee joint replacement rates in Australia. That is, every year, so many people they undergo knee joint replacement surgeries. Okay, and why? Because people do a lot of running. Okay, now you see over here, this is the opinion of whom? This is the opinion of a lot of people. Okay, so this is not the opinion of the speaker. Okay, not the opinion of the speaker. It is the opinion of some people. Okay, so many people are saying every year in Australia, many people, they get knee replacement surgeries. Why? Because they do a lot of running. So in Australia, a lot of people do a lot of running to keep themselves fit. And many people are saying because so many people are running, that is the reason why they are getting knee replacement surgeries. And this is the opinion of people, not the opinion of the speaker. Now, the opinion, now here the opinion of the speaker is, now this is what the speaker is saying. Now see, but means what? The exact opposite. But this is another myth. Now he is saying that is completely false. So the now this is the opinion of the speaker. What is the opinion of the speaker? That this information is a myth. That is, just because they are running every day, that running is not the reason why people get knee replacement surgeries. Now you see, because of this one single word, you are able to identify that the previous information was completely incorrect. Okay, the contrast over here. That is why we call it as contrast phrases, right? So now let's keep reading the sentence over here. In fact, now see, now he is saying his opinion. Okay, so see the word but. Now he's saying, in my opinion, in the speaker's opinion, this is just a myth. And now he's supporting his opinion. Okay, now see how he's supporting his opinion. In fact, studies show, now you see he's supporting his opinion. Studies means research. Studies show that for the majority of the people, that is, most of the people, running is helpful in terms of stopping the onset of osteoarthritis. Though, okay, so that we'll read. Okay, now see over here, what is the keyword over here? What is the key word over here? The key word over here is running. Okay, running over here. Now, as soon as you hear the word running, your eyesight should come to, your eyesight should come where? Your eyesight should come to answer option B, right? It should come to answer option B, because what is the word over here? Running. Okay, now you see this is the answer option B, running over here. So as soon as you hear the word running, and this is the opinion of the speaker, okay, here also they're talking about running. Now here also they're talking about running. So when they're talking about running, your eyesight is in answer option B. Okay, so what is answer option B telling? Running is probably effective as a means of preventing it. So your eyesight should only be in answer option B. Okay, now let's see whether that is the opinion, because your duty is to find whether what the opinion of the speaker is regarding knee osteoarthritis. Now he's saying that is another myth. Okay, now he's supporting that opinion by saying in majority of the people, running is helpful. Okay, running is helpful. Now what is synonym of helpful? Effective. Helpful, effective are synonyms. Okay, so now we are the same keywords are repeating. Running is repeated, effective is coming as a synonym. Okay, and over here, in terms of stopping the onset of osteoarthritis, stopping the onset. Onset basically means what? The beginning, right? Onset basically means the beginning. So the beginning of osteoarthritis, we can stop. And what is the word for that? Prevention. So what is the synonym for prevention? Stopping the onset. Okay. And don't you think that is the opinion over here? So in the very beginning itself, he is saying many people think running is very bad. Because of running only, people get knee replacement surgeries. Now he's using the word but, and he's saying that is a myth. So now we understand his opinion. Okay. So in his opinion, he is saying running is very good. And now he is giving a justification. Now he is saying in majority of the cases, okay, running is very, very effective. Running is helpful in terms of stopping the onset of osteoarthritis. So over here, the keywords and the verbs are all mentioned. What is the verb over here? Probably effective. Is that mentioned? Yes, that is mentioned. Okay, what about running? The word running over here. Is the word running mentioned? Is the keyword mentioned? It is mentioned. What about prevention, preventing it? Preventing this thing, that is also mentioned, right? That is all mentioned over here. So you can say with a very strong suspicion that B could be the correct answer, because directly they're coming with answer option B, and B, it is very difficult to eliminate. So with a high suspicion, you can say, okay, B is most likely to be the correct answer. I highly suspect it. So you can put a question mark beneath it. Okay, it is not eliminated because all the verbs and the keywords are mentioned, right? And that is the opinion over here. Now let's continue to read the statement over here. Now he is saying, though you are a marathon runner. Now you see, now this keyword is coming, marathon runner. Now, as soon as you hear this keyword over here, where is your eyesight going to go? Now your eyesight should come to answer option C. Okay, so from running, it should now come, your eyesight should now come to answer option C. Okay, now C is saying marathon runners should take precautions to avoid it. Okay, now your eyesight is over there. So let's see what he is saying. Now he's saying, though if you are a marathon runner, okay, you do potentially place yourself at some risk. Okay, potentially. Okay, potentially means high chances. Okay, there is a chance that you will put yourself at some risk of developing knee osteoarthritis if a person is a marathon runner. Right. Now, that's it. Okay. Okay. Let's see what. Okay. So now let's see what he is saying over here. Now, here, what is he saying? If you are a marathon runner, you should take precautions to avoid it. Okay. Now, see, what is his opinion over here? Now, should is a very strong word. Okay. Should is a very strong word. That means saying 100%. You should. If you are a marathon runner, then you will get knee osteoarthritis. So you must take precautions from today itself. Okay. That is his opinion over here. But is he saying that very strongly? Marathon runners is mentioned. Okay. But as you can see over here, he's just saying if you're a marathon runner, you put yourself at some risk of developing it. He's not saying you should take certain precautions. Okay, that compulsion is not there. So we cannot say that that could be the right answer. All right. So anyway, let's keep reading on. Now, if you have already got osteoarthritis, now you see over here, if you already got osteoarthritis basically means what? People with the condition, right? So now your eyesight should be in answer option A, and you should be able to eliminate answer option C by now. Okay, so C is eliminated and B is suspected to be the correct answer. And as I told you, C is eliminated. Why? C is eliminated because they have to take the precautions. Yeah, very good. All right, just give me a second. Right. Now, as you can see over here, we have eliminated C. You suspect B to be the correct answer. Now, your eyesight should come to answer option A, that is people with the condition. Okay, and why is your eyesight coming to answer option A? Because here they're telling if you already got osteoarthritis, already have osteoarthritis means you already are suffering from knee osteoarthritis. So that is answer option A. Now, what is answer option A telling? People with the condition are unlikely to benefit from running. That is, people who are suffering from knee osteoarthritis, if they are going to start running, they are not going to get any benefit. The chances of them getting any benefit is very, very less. So let's see if that is saying. Now, he is saying if you got osteoarthritis and you want to take up running, take up means if you want to start running, the data is a bit conflicting. Conflict basically means fight. Conflict means fight. So we have two types of data. Okay, so some people are saying running is good, some people are saying running is bad. Okay, the data is not precise, the data is conflicting. There are studies suggesting it can lead to exacerbations. Okay, exacerbations means what? Worsening. Okay, the condition can become worse. And now see the word but. So but is once again a contrast phrase over here. Okay, that is, it is bringing in a change. Okay, now what is this information? Running can lead to exacerbations of the conditions. Now, a different information is coming. Others suggest that patients who keep up running do better. Now you see, running do better at managing the condition. Now you see, this is exactly the opposite. Okay, so this information is saying running leads to exacerbations of knee osteoarthritis. This information is telling running will help people to manage the condition better. So again, two contrasting information. And how did we identify that? Because the word but is over here. Okay, so here he is saying there are two types of data, both are conflicting. Okay, if a patient is suffering from some people, it exacerbates, that is, its condition becomes very worse, but in some people, it helps them to manage the condition. Okay, than those who give it up. So let's see what is answer option A over here. Answer option A is telling people with the condition are unlikely to benefit from running. Okay, so what is the verb over here? The verb over here is unlikely to benefit, but that is not the case. Okay, so we talked about two things. Okay, we actually talked about two things over here. That is, yeah, talk exacerbation is mentioned. Okay, exacerbation means what? No benefit. Okay, that is the people who are running, it will exacerbate. That means no benefit is it actually become worse. But at the same time, we have another data. And what is that data telling? That data is telling running will help. Okay, so that is a conflict of information. Okay, so therefore, this we cannot choose. Okay, people with the condition are unlikely to benefit. It is not very precise over here. That is not the suggestion over here. So we can eliminate answer option A. Okay, and elimination of answer option C also should take precautions. Should basically is telling you have to. Okay, so because of that, we cannot choose answer option C. But if you take a look into answer option B, he's saying running is probably effective as a means of avoiding the onset of the disease, preventing it, and that everything is mentioned. And therefore, answer option B is the opinion. So this is the opinion he is having regarding knee osteoarthritis. So therefore, you will be choosing answer option B as the correct answer. Right. So again, this is also a little bit tough question. Okay, but I will play you the audio once again. Okay, so this time when I'm playing the audio, you should be able to track. Okay, so to be ready to track yourself, because you will be able to see. First, they will talk about answer option B, and then they will talk about answer option C, and then they will go to answer option A. Okay, and identify the opinion. Okay, so in the beginning itself, they're talking about running, contrast phrases will come. Okay, and all that. Okay, so I'll just play the audio once again so that see if it is fully understandable to you. And then we will go to the next question. So all the detailed lectures are already available in the app. All you have to do is just log in into the app. So as you can see, very detailed lectures, slides are all given for you 24/7 access. So let's hear the audio script.
About knees. A lot of people say there are very high knee joint replacement rates in Australia, for example, because people do a lot of running in an attempt to keep fit. But this is another myth. In fact, studies show that for the majority of people, running's helpful in terms of stopping the onset of osteoarthritis. Though if you're a marathon runner, you do potentially place yourself at some risk. Now, if you've already got osteoarthritis and you want to take up running, the data's a bit conflicting. There are studies suggesting it can lead to exacerbations of the condition, but others suggest that patients who keep up their running do better at managing the condition than those who give it up.
All right. So, okay. It's a little bit more clear, right? So this is how. So this is how you should, practice listening. Okay. One question itself, thoroughly understand it, dissect it, analyze it, and then move on to the next question or the question paper. Right. So here I have developed one document over here, and this document I will be sharing with you towards the end of the session. Let's take the 39th question. Yeah, as you can see. Okay, so this is an opinion-based question. Okay, it's an opinion-based question, attitude-based question. Okay, what does Michael say? Okay, so you have to identify the viewpoint, okay, the speaker's viewpoint or the interpretation of this particular person. Okay, so here, what are the strategies? Okay, you have to listen for the speaker's tone, okay, and qualifiers. We discussed about all these things. Now, see the word probably, potentially, conflicting. These are all what? These are all, qualifiers. Okay, which indicates the patient's attitude or evaluation. And you should be able to ignore the distractors, that is, eliminate the incorrect answer options A and C. Okay, because again, they are not fully correct. They don't reflect the overall opinion of the speaker. Okay, and use elimination strategy, as I told you. Okay, that is extremely important. And we have vocabulary guide over here as well. So the medical term, I mean the vocabulary, the meaning, and the synonyms. Okay, so I'll be sharing this document to you towards the session. Right. All right. So now let's take a look into the 39th question. 37, 38, 40th question, right? Yeah, 40th question. So this is also going to be an opinion type question. All right. Where are you? Okay. So everyone, read the 40th question. Now let's hear the audio script.
In fact, the sport that's often referred to as the knee surgeon's friend is netball. This is because it involves a lot of jumping, which puts pressure on the knee, which can cause a tear in the cruciate ligament, one of the main stabilizing ligaments in the knee. This often leads to the development of knee osteoarthritis within 10 to 15 years. In the hope of preventing this, players may be encouraged to have surgery to repair the cruciate ligament. But in most cases, this is probably unnecessary, and it doesn't appear to change their long-term risk of developing osteoarthritis. The best way to prevent the problem arising is actually to teach players to jump and land in the right way. Unfortunately, whilst professional players get taught this neuromuscular technique, most ordinary players don't know about it.
All right, so that was the audio script. So let's listen to the audio once again. So on the exam, you will not be hearing this one time. Okay, so here's for the sake of teaching. Now let's hear the audio script.
In fact, the sport that's often referred to as the knee surgeon's friend is netball. This is because it involves a lot of jumping, which puts pressure on the knee, which can cause a tear in the cruciate ligament, one of the main stabilizing ligaments in the knee. This often leads to the development of knee osteoarthritis within 10 to 15 years. In the hope of preventing this, players may be encouraged to have surgery to repair the cruciate ligament. But in most cases, this is probably unnecessary, and it doesn't appear to change their long-term risk of developing osteoarthritis. The best way to prevent the problem arising is actually to teach players to jump and land in the right way. Unfortunately, whilst professional players get taught this neuromuscular technique, most ordinary players don't know about it.
All right, so that was the audio script. Okay, so here they are talking about all the three answer options, A, B, and C. Okay, but if you listen very carefully, you will be able to make the connection like so. That is, first they will talk about, answer option C. Okay, you will be able to track the audio. First, answer option C, they will talk. Then they will talk about answer option B. And then they will talk about answer option A. So your eyesight should go from C to B to A. Okay, that is the format in which goes. And when you're in that one particular answer option, you must determine, okay, whether this can be eliminated or whether this can be not eliminated. Okay, so now let's read. Let's just understand what the question is. Okay, so this also is like, this is slightly comparatively easier question. Compared to this question, I would say this is a slightly manageable question, little bit more easier. I'm not saying it is very easy, but I'm saying it is comparatively easier. Now let's understand what our duty here is. So what is your duty? What does Michael say about damage to the cruciate ligament amongst netball players? Okay, so there is a game called netball, like football, basketball and all. There is a sport called netball. So in netball players, okay, amongst netball players, something happens. That is what happens. Damage to the cruciate ligament happens. Okay, so regarding damage to the cruciate ligament, Michael has an opinion. Okay, Michael is saying an opinion, and your duty is, what is his opinion about the damage that is happening to cruciate ligament in netball players? Okay, so answer option A, B, and C are all opinions. Okay, so let's read answer option A. Professional players are more likely to suffer this kind of injury. So what is this over here? Okay, so this connection you must be able to make. So this refers to damage to the crucial ligament. Okay, so this is what is referring to. Okay, so here he is saying professional players. Professional players means what? People who are professionals, that is, they are experts. Okay, expert netball players, they are more likely means chances are very, very high. These players, the chances are very high to suffer damage to cruciate ligament. Right. Now, let's take a look into answer option B. What is B answer option telling us? This can be avoided by training players how to move correctly. Now, here also the word this is coming. Okay, so what is this referring to? That connection you must be able to make. So this is referring to the damage to the cruciate ligament. This also over here. Okay, they're talking about the damage to the cruciate ligament. Okay, so here the speaker, the Michael's opinion is this damage to the cruciate ligament, it can be avoided. Okay, again, here also they're talking about healthy people. Okay, it can be prevented, it can be avoided by how? By training players. Okay, that is, you have to give them proper training. Okay, by training players how to move correctly. Okay, that is when they are playing this game, when they are playing netball, how to jump, how to run. Okay, so that correct training they should give. So if we are giving the correct training to the players, then they can avoid the damage to the cruciate ligament. Okay, that is the opinion of answer option of Michael over here, according to answer option C. Now, what is answer option C? Players who receive surgery. Okay, that is, here they are talking about the sick people. Okay, so answer option A and answer option B are all about healthy people. Okay, so here they are talking about healthy people because why? They don't have this damage yet. Okay, but here in answer option C, they're talking about sick people. Okay, sick people basically means people who have damage to the cruciate ligament. Okay, players who receive surgery, players who receive surgery for this. So here also, what is the word this referring to? This referring to the damage. Okay, damage to the cruciate ligament. People who receive surgery for this are at a higher risk of osteoarthritis. So here they're telling people who receive surgery, that is, they develop damage to the cruciate ligament and they underwent surgery, and post surgery, after operation, post surgery, they are at higher risk of developing osteoarthritis. Okay, that is what they are telling over here. Okay, so like this, we have comprehended the question. Okay, so let's just do the verb analysis. Okay, so here your duty is to find out what Michael has to say about the damage to the cruciate ligament. That is your duty. So let's see what is the A option. What's the focal point over here? Professional players are more likely to suffer. Okay, so here this is the action. Okay, more likely to suffer. Again, so professional players are more like, so who is more likely to suffer this damage? Professional players. Okay, so again, this you should keep in mind. Now, let's come to answer option B. What is B option? This can be avoided by training players how to move. So here the action is train players on how to move. That is, you have to give them correct training. Okay, so if you give them correct training, it will help them to prevent this damage. And C option, players who receive surgery at a higher risk of developing. So here they're talking about people who receive surgery. Okay, that is, who are sick, who have already damaged their this thing, right? And so forth. Okay, so now again, we have made it a little bit shorter over here. Okay, so answer option A, professional players more likely to suffer. Okay, this can be avoided by training people, training players, and C option, players who receive surgery for this. Okay, so see, receiving surgery, training people more likely to suffer. Three very different, information over here. Now, let's see what the audio script is telling us. Okay, so let's take the audio script. So we must remember the question. What is Michael's opinion about damage to the cruciate ligament? Okay, so let's read what he's saying. As I told you, your eyesight will go from answer option C, then answer option B, then answer option A. C, B, A. That is the order. Okay, so let me tell you why it is the answer, why that is the order. Now, here he's saying, in fact, the sport that's often referred to as knee surgeon's friend is netball. Okay, so here he is saying there is a game. Okay, there is a sport called netball and it has another name. Okay, this netball is called as knee surgeon's friend. Knee surgeon's friend means what? Okay, it is the friend of, say for example, if I have a friend, I will support my friend, right? So my friend wants 500 rupees. I will, give him 500 rupees because he's my dear friend. Okay, so here netball. Okay, netball over here, he is the friend of whom? Netball is the friend of the knee surgeon. Okay, so that means people who are playing netball, people who are playing netball, they end up paying the knee surgeon. That means what? People who are playing netball, they are going to pay for surgery. Okay, people are going to pay for knee surgery. So if 100 people are playing netball, all 100 people are going to pay for knee surgery. Who is going to get the benefit? The knee surgeon, right? So knee surgeon is going to get the benefit. He is going to become very rich. Okay, so that is the meaning over here. That means that is why netball is called knee surgeon's friend. People who play netball, they are going to damage their knee, and as a result, the surgeon, the knee surgeon, is going to get the benefit. So netball is a very good friend of knee surgeon. Okay, again, like this, you should be able to understand the meaning. Without understanding the meaning and all is going to be very, very tough. Okay, so in fact, there is a sport that's often referred to as the knee surgeon's friend, that is netball. This is because, now see, why is it called? This basically means what? Means why it is called knee surgeon's friend. Now he is giving his reason because it involves a lot of jumping. Okay, so in this particular game, a lot of jumping is involved, which puts pressure on the knee. Okay, so when too much jumping is there, too much pressure is on the knee, which can cause a tear in the cruciate ligament. So all of this will cause a damage to the cruciate ligament. Okay, so this is the main topic over here, and that is what they're asking you. Regarding this, what is the Michael saying? One of the main stabilizing ligaments of the knee. Now you see over here, all this information, okay, this entire information up until here, we can say it is a distractor. Right, because he is just saying there is a game. The name of the game is a netball, and this is called as a knee surgeon's friend. In netball, there is a lot of jumping. There's a lot of pressure on the knee, and because of this damage, the cruciate ligament happens. So these are all distracting information. This is not at all what we are looking for. Our duty is what? Our duty is the opinion Michael has about the damage to the thing. We don't want to know what netball is and why damage to cruciate ligament happens. So this focus, okay, so if you have a clear focus on what the question is, you will be able to identify the distracting information like so. Right. So now let's keep reading. Okay. Again, so this is the main stabilizing ligaments. Okay. These are all distracting information. We don't care what cruciate ligament is. This often leads to development of knee osteoarthritis within 10 to 15 years. Okay, so what happens because of this tear in cruciate ligament in within 10 to 15 years, the people will start developing knee osteoarthritis. In the hope of preventing this, okay, so to prevent this, this basically means what? What is the word this referring to? Can anyone tell me? Here, what is the word this referring to? In the hope of preventing this osteoarthritis. Okay, so here they're talking about knee osteoarthritis. So in the, yeah, very good. Okay, in the hope of preventing knee osteoarthritis, players may be encouraged to have surgery to repair the cruciate ligament. Now you see over here, we are talking about surgery over here. Okay, now which answer option has the word surgery? C option. Okay, so your eyesight will come to answer option C. The very first answer option is answer option C. Your eyesight is now in answer option C. What is answer option C telling? Players who receive surgery for this are at higher risk of osteoarthritis. But that is the exact opposite. Okay, here, what is this? What are they telling over here? Okay, in the hope of preventing osteoarthritis, people may be encouraged to have surgery to repair the cruciate ligament. Okay. So here they're telling people are encouraged. Okay, players are usually encouraged to have surgery to repair the cruciate ligament, and why? This will prevent osteoarthritis. Okay, so make the connection very carefully. Huh? So here, what are they saying? Surgery. What surgery? Repairing the cruciate ligament. Okay, repairing the cruciate. This is the surgery. And why are they doing this? They are doing this to prevent knee osteoarthritis. Are you able to make the connection? Okay, so I'll just type it once again over here. Okay, so according to the thing, surgery prevents knee osteoarthritis. Okay, that is what he's saying. Now see, players are encouraged to have surgery and repair the cruciate ligament. And why? Why are they encouraged? So that they can prevent knee osteoarthritis. So surgery prevents knee osteoarthritis. But what is answer option C telling? Answer option C is telling surgery puts people at risk of osteoarthritis. So can we choose answer option C? Okay, that is people who receive surgery, they are at higher risk of osteo. That is the exact opposite. Okay. Surgery is actually going to prevent. Okay. Surgery is used to prevent osteoarthritis. Okay. So here they're telling people who do surgery, they are at a higher risk of osteoarthritis. That is the direct opposite. So your eyesight came to answer option C, and the first answer option you eliminated is answer option C. Now C is eliminated. No doubt about it. Okay, it is the exact contradiction of what they said in the audio. Now you have two answer options, A and B. So now C, you completely ignore it. Now it is either A or it is either B, right? So now let's go to the audio script once again. Now he's saying, but in most cases, this is probably unnecessary. Okay, that is this surgery. Okay, here the word this basically means surgery. Okay, that is surgery is probably unnecessary, and it does not appear to change their long-term risk of developing osteoarthritis. Okay, so here is saying surgery is probably unnecessary. Okay, it does not appear to change their long-term risk of developing osteoarthritis. So he is saying even if they do surgery also, okay, it is not going to really help them. Okay, it is not going to. Now see, it doesn't appear is what? That is a qualifier. Okay, that is a qualifier, does not appear as a qualifier. He is saying it does not appear, that means it will not change their long-term risk of developing osteoarthritis. So even if they do surgery, and if they don't do surgery also, they have a long-term risk of developing osteoarthritis. So therefore, surgery is unnecessary. So what is the opinion over here? He is saying surgery is unnecessary because if you do surgery, if you don't do surgery, you are going to put yourself at a long-term risk of developing osteoarthritis. But that is not the case. Your duty is to not find the opinion about surgery. Here, our duty is to find his opinion about damage to the cruciate ligament. Okay, and see, we have already eliminated. Now let's come to the next sentence. The best way to prevent the problem. Okay, now the word prevent over here. Okay, now see, avoided. Okay, so what is answer option B telling? B is avoided. So this is the word prevention. So the word prevention is coming. So now your eyesight from answer option C, you should go to answer option B. Okay, the best way to prevent the problem is actually, now see, he is saying, okay, to prevent, what is the problem over here? The problem is damage to the cruciate ligament. Now you see the tear in the cruciate ligament. This is the problem over here. Yes or no? Right? So that is the problem. Okay, tear in the cruciate ligament, and this is the problem. And here he was talking about how to prevent this problem. Okay, and how, what is he saying? Actually, to teach players to jump and land in the teach players. Okay, so teach. Okay, teaching players to jump and land in the right way. Teach means what? Training. Okay, so I am teaching you, I am training you. Okay, so that is a synonym. Okay, so prevention, avoid, prevention. So they are using synonyms over here. What is B option telling? The damage to the cruciate ligament can be avoided by training players how to move correctly. Now you see over here what is saying? The best way to prevent the damage to the cruciate ligament is actually to train the players. Okay, teach the players to jump and land in the right way. And what is that? How to move correctly. Jumping and landing is movement, right? So all the keywords are mentioned over here. Okay. This is mentioned, that is damage. The problem is mentioned. Avoided, prevention is mentioned. Teaching, training is mentioned. Jumping, how to move and land. Okay. Everything is mentioned. Okay. Movement. All these keywords are mentioned. And that is the opinion that he is having regarding damage to the cruciate ligament. So you can say with a very high suspicion that answer option B could be the correct answer, because A we still haven't dealt with. Or you can right now itself, if you want, you can choose answer option B as the correct answer. And C we have already eliminated because higher risk of osteoarthritis. Right. So now let's read the audio script once again. Unfortunately, whilst professional players, now see, professional players are what? In answer option A. Now your eyesight should go to answer option A, right? Professional players are likely to suffer this kind of injury. Now he's saying, unfortunately, professional players get taught this neuromuscular technique. Most ordinary players don't. Now see, he is saying professional players, they actually are trained. Okay, they are trained this neuromuscular technique. So neuromuscular technique is basically teaching players how to jump and how to land. That is what we call as neuromuscular. And professional players are getting this knowledge. Professional players are getting the knowledge regarding this, but ordinary players, they don't know anything about it. Okay. So here, what is answer option A? Professional players are more likely to suffer this kind of injury. So what is the action over here? What is verb over here? Likely to suffer. Okay, this kind of injury that is not mentioned. Okay, it is not at all mentioned anywhere. They have already mentioned professional players only. The keyword is mentioned, but the verb is not mentioned. So you can eliminate answer option A. Elimination answer option B, and that means the correct answer option will be B option. Right? So B will be the right answer. So this is how you should be able to choose the correct answer. So I'll play the audio once again, and you move your eyesight, okay, from C to B to A, C, B, A. You should be able to make the connection, and one by one, you should be able to eliminate. So C, you have to be eliminating first. And then B, if you listen very carefully, you can say, okay, this is the opinion he's saying. And then A also, you can be able to eliminate. Okay, so I'm going to play the audio now. Just give me a second.
Referred to as the knee surgeon's friend.
The audio script.
In fact, the sport that's often referred to as the knee surgeon's friend is netball. This is because it involves a lot of jumping, which puts pressure on the knee, which can cause a tear in the cruciate ligament, one of the main stabilizing ligaments in the knee. This often leads to the development of knee osteoarthritis within 10 to 15 years. In the hope of preventing this, players may be encouraged to have surgery to repair the cruciate ligament. But in most cases, this is probably unnecessary, and it doesn't appear to change their long-term risk of developing osteoarthritis. The best way to prevent the problem arising is actually to teach players to jump and land in the right way. Unfortunately, whilst professional players get taught this neuromuscular technique, most ordinary players don't know about it.
All right. So that was, okay. That is how this particular answer is done. So today we talked about opinion type questions. Okay. We talked about contrast phrases, and we talked about qualifiers, and we did 2 live questions as well. And that was, if you listen once again, if you listen to the session, you'll be able to see there are a lot of qualifiers there, a lot of contrast phrases there, which will help you to identify the opinion of the person. Okay, so again, this is tough. Okay, so the listening part C is usually the most difficult. So if you feel that this challenging, no worries. Okay, it is expected. Slow and steady only, you will be able to develop the skills. Okay, so it is supposed to feel difficult. That is where true growth happens. Okay, so what are the topics we covered today? So we covered 2 opinion-based questions. We analyzed it. All right. And we talked about the right strategies to identify the attitude as well as the intent of the speaker. We talked about what contrast phrases are, what qualifiers are in spoken English, right? And I'll be sharing you with the documents that I have prepared, that is vocabulary, and regarding all these things. Okay. So these are the benefits that I hope you may have received by the end of the session. So here for the 40th question also, I have prepared a document over here. So I'll be sending this document to you towards the end of the session. Okay, so here, damage to cruciate ligament. Okay, so this question over here, it is once again an opinion-based question. Okay, what does Michael say? So that means you have to identify the viewpoint. Okay, or recommendation of this person called Michael. So from his perspective, we should be able to think. Okay, so he's talking about so many things. And what are the strategies? Listen for the speaker's recommendation. Okay, again, there are a lot of misleading details, right? A lot of distracting information is there, especially in the beginning and all. Okay, and why answer option C and A is wrong, that will have mentioned to you. And see, there are a lot of contrast and qualifiers. In most cases, probably unnecessary. Okay, see, probably, it doesn't appear to change. Okay, these are all what we call as qualifiers, and if you're able to identify them very clearly, it will help to eliminate, it will help in your ability to eliminate the incorrect answer options. Okay, so like that. And here I have made a vocabulary list as well. The terms are mentioned, the meanings and synonyms as well. So towards the end, I'll be sharing you this document, so you can just make a note of it. All right, so that is the end of today's discussion of listening part C. Thank you.